Welcome. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. August 2025, a really interesting issue, an international flavour. We have 3 feature articles, 5 other reports, a PCCM conference report, a commentary, an editor's note, a PCCM narrative, a research letter, and some correspondence. The 3 feature articles. The first one is by Slater et al. From Australia. This looks at long-term survival using the ANZIX database 1997 to 2018, over 95,000 children, and there's an accompanying editorial by Hennigan and Pinto. The second report comes from Middleton et al. This is a post-sepsis care needs in children and families, a qualitative study in Western Australia. The third study is by Winter et al., and this looks at the death 1 hour after terminal extubation dataset, or the DONATE database. And this is a machine learning study on the data from 2009 to 2021, and there's an accompanying editorial by Kemper and Fackler. The 5 other reports. The first, by St. Louis et al. This is a scoping review of infant organ donation after death by circulatory criteria. The second report is by Hay et al., and this comes out of the hackathon machine learning crowdsourcing work that was done at the WIFPICS conference in 2024, and this is generation of a database to do with child and family outcomes after PICU admission. This will be a huge resource that will be available. Hernandez et al. From Colombia look at prolactin and the endothelium in 230 patients with septic shock or sepsis from 2021 to 2024. Then Au et al. Look at hyperlactatemia in critically ill children who go onto ECMO and are modelling the recovery kinetics. And lastly, Li et al. From China look at cases of bacterial and viral pneumonia, 152 children, and assessing plasma biomarkers in regard to severity of the respiratory disease. There's a PCCM conference report by Lyons et al., and this is about palliative care subcompetencies for PCCM fellowship training. There's a commentary by Kingsley et al. About access to technology-driven critical care interventions in children with severe neurological impairment. There's my editor's notes on post-PICU outcomes and the chronology and what we've learnt over the years. There's a PCCM narrative from Italy by Carlo Bellini, who's in Genoa. Then there's a research letter from the Netherlands by Van Twist et al., looking at the energy impact of powering down devices that we have on the PICU. And lastly, regarding correspondence, there's an item by Horvat et al. About the recent literature that we've had on the Phoenix criteria, and there's a response by Schlappbach et al. So all in all, a great read for August, and I will see you next month. Thank you.